Hello, everybody, and welcome back to another ARPneuro Q&A. My name is Jake. I am your trainer, and of course, with us, as always, is the infamous pickleball playing, rapping extraordinaire, Matt Amy Adams Dell. Who in the world is Amy Adams? I honestly
I'm glad you asked that. I couldn't find a rapper. Our guest tonight is from Castle Rock, Colorado.
Okay.
So in doing my research for tonight's Q&A, I did a search on any famous person, celebrity from Castle Rock, Colorado, and Amy Adams is the most famous person that has lived in Castle Rock. And I'm like, okay, I didn't know until I saw the picture, but once you see her picture, I don't know if you could pull it up, Jake.
All right.
Okay. That's Amy Adams. She is, I think, Academy Award. She was in some great movies, one of which my favorites, let me see here, American Hustle. She was fantastic. And if you remember that picture.
I do.
She was awesome in The Fighter. Remember The Fighter?
Yes. I didn't know she was in The Fighter. I completely forgot.
Yeah. So in preparation for our guest speaker, I had to be somebody from Castle Rock, Colorado. I understand our guest tonight has been in Castle Rock for about 12 years, so I can't wait to get to her. So really excited about our guest.
I absolutely love it. All right, Perfect. Matt. So how are you doing today?
I'm doing fantastic. You know, I'm a little depressed? Very depressed.
Uh-oh, because the Bears got spanked again?
Don't even get me started. This was it. I think the NFL has something against the Chicago Bears is all I'm saying. Because
maybe that's the excuse.
I am clinically depressed. It was supposed to be a big year, and now all of a sudden now I'm, looking for other activities like maybe pickleball tournaments I can go watch.
I mean, I have a feeling that pickleball players do a better job than the Bears right now.
Exactly.
That's a quarterback as good as Fields. That's where careers go to die, unfortunately, because he's amazing and he's on the wrong team.
I don't know. I don't even. Let's stay positive tonight. So
you got it.
Jump in, and as always, I want to just give a little background for anybody that's listening in tonight that does not know anything about ARPneuro. ARPneuro, you can go to the next slide. The technology that we're going to be talking about has been around for 20 plus years. It is still, in my opinion, the best kept secret in a modality to help all kinds of different conditions. And I'm excited to hear, Jake, you're going to talk a little bit tonight about hand baths, I believe, and can't wait to hear Dr. Meghan's experience with ARP. But the technology has been around for 20 years, and really it's been primarily utilized by professional athletes with a much faster recovery, preventive recovery, and physical therapy. You can go to the next slide. So if you've seen it or if you've been to our website, we start adding professional athletes that you may know of that have used this technology. As a matter of fact, NFL, Major League Baseball. And what we're trying to do is bring this to collegiate athlete, high school athletes, weekend warriors, really anybody that's trying to get, moving a little bit better, whether it's preventative or whether it's rehab. So we'll go into that in a little more detail. Really, there's two different products that we'll be talking about tonight. There's the RX100, which is, does 500 contractions per second. And Jake will get into much more technical detail. And the PRS, which is an over-the-counter, fantastic for traveling, very small device, very easy to use, and does everything the same as the RX, just a little less contractions, 245 contractions per second. And we'll talk a little bit about that as we do a comparison on a slide coming up. I mean, celebrities, Lane Johnson, great article, and he's on the Philadelphia Eagles. As a matter of fact, I think we just posted, he was using the PRS, the over-the-counter device, in preparation of yesterday's Eagles victory against the New England Patriots. And he was able to play in the playoffs with a torn groin muscle, utilizing the RX and treating that all the way through the playoffs and including the Super Bowl last year. So you may have heard that or seen that on our website as well. So really, a lot of people ask, so what is ARPneuro? What is the PRS? What is the RX? What does it actually do? How does it compare to the a TENS unit, which almost everybody knows of? And so, Jake, I'd love to get your definition of the comparison, because it's really not comparable, but go ahead.
Absolutely. Yeah. So one of the first things I always target is the type of current. So TENS unit's going to be on an alternating current. That's what you're going to see on 90 to 95%, perhaps even more on the market. As far as electrical stim units, they're going to be on an alternating current. So this is going to be a comparison with a lot of those on top of the TENS unit, as you can see here. Now, the TENS unit's going to be able to contract the muscles around 10 times per second, very similar to what your body can do. The difference is the TENS unit doesn't do it the same way your body does it. So it's going to be physiological. The PRS, that's our take-home unit, as well as the RX, both are going to contract on a direct current wave, which is the same type of wave your brain uses to contract a muscle. So it's harmonious with the body, and that also makes it neurological. So when you're going through movements, you are able to retrain those muscles, as well as getting that high contraction speed, that Matt talked about with our take-home unit, 245 times per second, which is just astounding compared to what else you'll see on the market. And of course, the RX, just off the charts of 500 times per second. But that coupled with all the blood flow you're getting, and as well as, that cellular level that you're just not going to see with those other take-home units on alternating current.
Awesome. Good definition. Yeah, as a matter of fact, you'll probably start hearing more and more about this technology in ARPneuro. Logan University, big university in St. Louis, they graduated about 400 DCs annually. It's now part of their curriculum. They've got a clinic that they're utilizing the technology. Kaiser University, another large university, is integrating that into their curriculum as well. So I think what you'll start seeing more and more is this technology taking over. I think the interesting part, hearing from the VP of Innovation and Technology that really did a deep dive into this technology, the whole committee was blown away about the outcomes, and that's kind of stimulated our slogan as it's all about the outcomes, because as they're diving in to understand this neurologically and how it's working, the one thing that they said, you can't argue with the outcomes and the success that patients have seen utilizing this technology. So very excited.
Yeah. And one thing to add on that, Matt, is that we are actually going over to Kaiser in West Palm Beach, Florida next weekend. So that's going to be exciting. Everyone's often asking about studies and, when are we going to get some new studies on top of the ones we always share? They're years old. He has been doing a lot of testing with this. We're very excited. The students are excited about it. So Kaiser has really stepped up to the game on this. And I can't wait to see what they bring back when we start to talk to them more often. So we have a pretty good cadence with them, and I don't expect that to change anytime soon, because they have really they've become really affectionate towards the technology, and they're just absolutely drenched in what it can do. So I'm excited to see where it goes.
Jay, correct me if I'm wrong. Are they doing some sort of open to the public kind of discussion on ARPneuro? Is that next weekend?
They sure are, and I'm glad you brought it up. It is next weekend. It's on the 23rd. It's on a Saturday, and it's going to be in Kaiser at the West Palm Beach campus. So If you want more information on it, we can certainly get it to you, but it is open to the public. So they're going to, like I said, they're doing a deep dive on the technology, a lot of research they've been doing with the students. They're excited about it, and I will say they've come up with some new things and using it in ways that we haven't yet, with some great results. So it's going to be fun. Must see if you could be there for sure.
Well, maybe we can get some information on our website at ARPneuro.com for any of those that are interested, to checking that out. But awesome.
Absolutely.
Thanks for that.
Absolutely.
Yeah, this is my personal story, and I've learned so much, especially with these Q&As, on how this technology has helped. But this is my son, broke his leg senior year in high school. They put a rod between his knee and his ankle. And all the doctors basically said there's no way he's coming back to play basketball. And he proved them all wrong, utilizing 20 treatments of the RX. And basically that's him playing the last 5 games of the season. So I saw it firsthand. Although he couldn't put any weight on his leg for quite a while, he was able to utilize the contractions, build the muscle, keep the muscle strong, so that when the bone healed, he was able to actually play. So kind of blew me away that this was actually going to work, especially against all the doctors that said that he was pretty much done for the year. But again, one of the things that I've learned through this is, people tell me, oh, my knee hurts, my elbow, my shoulder. What I've learned with this is it's able to pinpoint the origin of the problem and really help strengthen those muscles around the area so that you can actually A, relieve that pain, and B, have those muscles firing the way they're supposed to or intended to do, so that you can take away and function, whether it's a professional athlete or a weekend warrior playing pickle. So
nice. Common story, but it's still unreal to see it, time and again. That's the success it's had.
For sure.
So yeah, this one is kind of my forte. So I'll kind of jump in here and give you a little break, Matt, and bore them with my voice here. But again, a lot of the things that what ARPneuro can do, as you can see here, alleviating pain, preventing injury. I always like to focus on that one because it does have the ability to find some of those muscular breakdowns and prevent an injury from happening. And those of you that are in sports and super competitive, obviously that's a good reason to experience this device, have this device, and be treated by it, because it's going to catch something before it happens and it keeps you in your sport. A lot of times you'll see this. It's a very common story. Someone will blow their knee out on the sidelines or doing something very minor. And it's not that that person is weak. It's that something else outside of that area was just not firing properly. So we do have the ability to find that, strengthen it, so that way it does prevent that, that ability of going in and getting injured. And then you're out for 6 to 8 weeks, as opposed to catching it before it happens and you can continue to play your sport. But that's just as important for a weekend warrior. It's just as important for somebody who's just going through their daily life. To prevent injury, that's not going to slow you down for anything. I mean, it definitely has an importance all around the board. So on top of all the other things, and we'll kind of get into the increased of range of motion. I know Dr. Meghan will have a lot to talk about on a lot of these. So I'll stop rambling so we can get to the real stuff.
Well, before you stop rambling, I do want to say one thing, and I hope I say this right, because it's a big word that you've used throughout these Q&As, and that's compensatory. Mm-hmm. Okay. Yep. If I understand compensatory, and I love that word because now I can say it, I've heard it 20 times. I don't really know the meaning, but I believe compensatory is, you are doing so. Let's say it's a runner. Let's say you have some knee issues and you're running awkwardly because of some compensatory issue with a muscle, right? And that typically will lead to an injury. And and correct me if I'm wrong, right? So now all of a sudden we can determine that, get it fixed, and get that issue resolved so that the muscle's functioning the way it's supposed to. Did I butcher that, or was I pretty accurate?
No, you didn't butcher it at all. Compensatory is just essentially compensations, and that can be developed through pain. It could be developed through just bad form. You might rely on muscles that are stronger, or they're taking over. They're hyper. They're kind of a hypertonic portion, but for the most part, that's what happens. And when you're starting to compensate, there's going to be certain muscular breakdowns, and that's usually where an injury starts. So it helps remove those and kind of re-ravel them the way they're supposed to be. It's essentially what we like to say in the past is it's bringing you back to your child, where when you were a child, you can move freely. That's what we want you to do as an adult, is be able to move freely. So I think you knocked it out of the park.
Yeah, I'm going to have to start being Matt Dr. Dell between compensatory and modality. I mean, it's like, come on.
Well, with all due respect, maybe you should stick to Dr. Dre.
Okay, well, that's probably closer to this is a great slide, and it's amazing. I was just talking to a friend that he got an invite for tonight's session. Hopefully he's going to join, but he's starting to get neuropathy of his foot. The doctors are saying they don't even know what's going on. He's getting that tingling. There's so many different common conditions that this technology can help solve. And, whether it's concussions or rotator shoulders, elbows, I mean, it is amazing. I can't wait to hear from Dr. Meghan and some of the common conditions that she supported. As a matter of fact, I've got to go on record, in all of our Q&As to date, we've never had people already come on the question saying, she's got a fan saying, proud of you, Meg. I mean, This is awesome. And we haven't even started. We haven't introduced her. So
rock star already, I know.
Judith Lane is like already excited to hear Dr. Meghan talk. So I won't, we can go to the next. I'll let you jump into this.
Moving on. So we're going to get into a lot of this anyway when I start to get into some of the training. We're a little bit on the neuropathy, is going to be on the hand bath, but most of the neuropathy today will be by Dr. Meghan. So I'm only going to touch on that and allow her to really open that up for sure. But again, kind of talking about how it works, being able to, again, that direct current, you're going to see in the next protocol I'm going to talk about, where that current being a direct current, really, we use that to our advantage. Being able to pull out inflammation, get blood flow into a certain area. We can, as we're moving that inflammation out, we're getting, we're contracting muscles and we're firing things up that were probably dormant. So there's many factors as to how it works and why it works. And we'll get into a lot of that, especially when it comes to the neuropathy portion.
Yeah, I mean, it's all about the outcomes, Jake, as we've talked about. And on our website, we continue to ask anybody that's on tonight's Q&A or anybody that's had experience with it. We'd love to hear from you. We've got a very simple email or link we can send you. I think it's on our website. Don't quote me on that, but we'd love to hear from you. Put your story up so you can help others that are either suffering from ankle, back, neck, any areas that this technology has been able to help. So.
Absolutely. And since we're on that, just keep in mind as we're going through this Q&A, if you're a part of it, you can ask a question now. We do have, an area where you can post a comment. If it comes up to you afterwards, you can always reach out to us at info@arpneuro.com.
Very good.
All right. So I'm going to get into this really quickly. It's very similar. If you have watched our Q&As in the past, it's very similar to the foot bath. Of course, this is going to be more of the upper body. A lot of this we use as more of it's still active in many ways. And, we'll kind of talk about that, but it's more passive than some of the other things that we do, especially with upper body. But this is good if you have any inflammation, if you have arthritis, especially in some cases with rheumatoid arthritis. It helps draw out a lot of that inflammation. It helps contract a lot of those muscles, and it gets those fingers moving again. Obviously, there's no muscles in your fingers, but everything that goes up there into your forearm and even as high as your shoulder, that can affect a lot of that, and it can also create pain. So this is able to pull you out of that. And essentially, we do mark it down as a 20-minute session, normal polarity. Again, just to emphasize the way this technology works, it's very important to know that, because then you can use it to your advantage. So on normal polarity, it's always the black running to the red. Now, as you can see here, I have both units up there. I have the RX 100 that's to your left as you're looking at it. And then, of course, the PRS. I'm kind of running the hand bath with the PRS in this photo. So you can use the PRS, which is a take-home unit, and kind of sort of replicate this type of modality. It's not going to be as intense, but it's still going to give you some of those benefits of pulling out inflammation, contracting those muscles, and kind of waking some of those areas up. Very basic clamshell. So even the PRS has this setup. This still has current going through it. So you just take that clamshell pad and you're using a sponge. Now this one happens to be blue. Sometimes when you order a PRS, it might be yellow. It does not matter. You just want to make sure a sponge is on there, because you don't want that clamshell on your direct skin. And then from that point, as you can see here, I'm just placing the sponge with the clamshell pad on the palm of my hand. Now, in some cases, we do move that around. We might go a little higher, maybe a little closer to the fingers, but for the most part, it's ideal in that location, just because it disperses the energy pretty well. And then you just it's a lot easier to wrap up for sure. And then from that point, you just place your hand in the water. So that's where the black pad goes. But the full setup here, as you can see in this diagram, may be hard to read, but that red lead is going to be on that top right side of that scapula area. So somewhere in infraspinatus area. And then, of course, you have that black clamshell on the opposite hand. Now, the reason for that has a lot to do with that inflammation. So what technically happens here is that black pad is running energy towards the red. We kind of say it kind of talks to that pad. So for it to go from there all the way to the opposite side, it has a longer pathway. So that longer pathway draws out more inflammation, as opposed to just going from right palm to right infraspinatus. Instead, we're going right palm all the way across to the other side to left infraspinatus and drawing out more inflammation. So keep that in mind. Some of the things to look for in this And I actually, when we're treating, we try to push it to this level. We want to see some of those breakdowns. And this is a kind of a sign of that. As you can see, my index finger is curled up. This is just force that it's not able to absorb. But what you're going to notice as you go through this treatment is you're eventually, as you breathe through it, it's kind of that typical yoga breath. As you can see there, it's a deep breath in through your nose and then a slow exhale from your mouth. Oftentimes on that first or second attempt on that exhale, you or the patient is able to extend their hands and get it nice and flat to the water, and then keep it flat. So what tends to happen is every couple minutes, while what seemed to be too intense ends up subsiding pretty quickly. And you'll find that the patient or yourself will able to tolerate more and more throughout that 20-minute session. Before you realize that you might have been on output power numbers of 3 or 5, and then you end up finishing at 10, 12, sometimes even higher, which is pretty good for a hand bath because it can be relatively intense. Now, one of the things I didn't talk about is people usually ask about the temperature of the water. It's not extremely important. I will say a lot of times I go with like a lukewarm or a warmer water just for patient comfort. Now, the water is good because it acts as a magnifier. So a lot of times what I do explain it as is almost like a vice grip squeezing around the wrist, but it does help pull out that inflammation. So think of this, especially in the case of the treatment side on the RX100, when it's contracting muscles at 500 times per second. Now you magnify that with the ability for putting water in there. So it makes it that much more intense and that much more ability to recover a lot quicker. Technically, you can run this dry, meaning you can run a sticky pad on the palm and then, cross it over the same way without water. But this is definitely a more successful protocol, which is one of the reasons it's our go-to for any type of neuropathy, sometimes arthritis as well. And even like wrist sprains and things of that nature. A question popped up before I go to my next slide that I want to handle right away is, can you do a foot bath as you do a hand bath? It's interesting. Yes, you can. I've actually, I had a person that I was traveling with. We used their pool, and then we used 2 hand tubs. She had 2 hand tubs on each side, and then she had her feet in the pool. So we have used both. She suffered from rheumatoid arthritis, so you can do that. Just be careful with the output power numbers. And I will say this, it is intense. So, treat it that way. It's like a workout, but it's like an intense workout. So even afterwards, you can still get that delayed onset muscle soreness.
So Jake, just jumping in here, a question.
Yep.
So basically, jammed fingers, sprained wrist. Do you want the wrist in the water itself? Beneath the water, if you have a wrist issue, or
I do like to go above the wrist. What you'll notice is the higher you go, the more pressure you're going to get outside. So I do like to go just above that wrist.
Okay.
And if you get intense enough, you can get a lot of those sensations. I think I said this, even before, all the way up to the shoulder, sometimes even to the lat. So it does have that ability. Yeah.
So great treatment for jammed fingers for basketball players or football guys, or wrists, or any kind of sprain. Great way of
That's actually a great point. In any sport like that, where you're using it, even I would even say pickleball, as something you play a lot of, and you're just that constant repetitive motion. I would recommend if you're doing something like that, this is going to be beneficial. And I'm even going to go on a limb here, and it's not much of a limb. I mean, if you're on the computer all day and you're clicking on a mouse, chances are you're going to develop carpal tunnel, and this is going to help with that. So there's nothing wrong with finishing your day with a hand bath. So that's a great point.
Awesome.
We already know this is Amy Adams now. So
I love it. Well, the second, let's just start by saying Amy Adams is probably, without question, the second most famous person. Do you agree?
I agree, because I know where we're going with this.
Castle Rock, Colorado. She's got to be the second, because we're about to introduce the first.
Right here. Yeah, absolutely. And this is what everyone's been waiting for. So I won't, without further ado, I'm going to continue on with this presentation of our special guest. So she is the visionary owner and physical therapist behind Fix-It Therapies in Castle Rock, Colorado, with a doctorate in physical therapy from Sacred Heart University, and with a rich background in clinical investigation and therapeutic techniques. She offers integrative care that prioritizes overall wellness and quality of life. I wish she was an English teacher so she can teach me how to read. At Fix-It Therapies, her expertise extends beyond traditional methods with certifications in strength and conditioning, clinical management of fitness, and therapeutic dry needling. She's a dynamic force in this field. In addition to her notable achievements, she will discuss the cutting-edge solutions she is bringing to the forefront of physical therapy and rehabilitation. So everyone, please give a warm welcome to Dr. Meghan. Dr. Meghan, thank you so much for being here. It's good to have you with us. And yeah, welcome.
Thank you so much.
Yeah, we've never really had anybody, you know, in all of our Q&As already plugging you before we even introduce you. So we've got a great fan base on tonight. So very excited to, you know, please tell us a little bit about yourself and your practice. And understand you've been in Castle Rock for about 12 years.
Yes, I've been in Castle Rock for 12 years. I love it out here. It's given me the opportunity to treat all of the athletes and all of the health conscious individuals from Colorado. I started practicing in Boston, Massachusetts 13 years ago, and I've been spending my whole career working with outpatient clinics and working with patients doing spine health and sport injuries, athletes, and traumatic injuries and car accidents. So it's been quite a journey, like working throughout and learning all these different technologies to be able to interplay with physical therapy. So it's been a blast. Yeah.
Awesome. So out of curiosity, how and when did you hear about ARPneuro, and please share that story with us, and how long have you been utilizing it in your practice?
I've been using ARPneuro for the past 5 years, and I originally was introduced by Dr. DeBrinket. So one of my colleagues who's also a very creative and curious researcher, was looking into different modalities, and we were talking back and forth about different things that we could do I was talking back and forth about different things that I could implement into my practice to make it more focused and specialized. And so when I found out about ARP technologies, he was using it, and he's like, hey, let's come on over and check this out. And I immediately was drawn to it because it was a way to create an accelerated rehab performance platform for people. And I like the fact that I could use it both in office as well as do rental units for my patients for continued use. So
okay, nice.
That was initially.
And is that utilizing the PRS? Is that what you share that with your patients so they can take it home? And
oh, absolutely. Yeah, the PRS unit is rentable from my clinic. So I'll see people and I'll use the larger unit to be able to find out my locations of where to start with the therapy there. And we'll use that one that is at the 500 contractions per second while we're in clinic. But then if there's any carryover and they need to go home and be able to use it alongside their rehab, they're leaving with the PRS, and they're able to do like the peripheral neuropathy baths while they're at home and be able to accelerate their care that way. A lot of my sports athletes will injure themselves. I have a lot of children that will come in and they'll just need to have a game and go away on a travel game. And so they'll take the unit for that travel game so they can perform back-to-back events and at their height of their ability levels. I mean, the Colorado sports game and athletes is pretty strong. So being able to be a provider that keeps them on target has been wonderful. And that's all because of that ARP technology. So
that's great. I'd love to hear from you a little bit about the scanning. Tell us a little bit about that and how you use the scanning portion to pinpoint the origin of the issue.
So typically when they come in, they'll have per se like a shoulder cuff issue. Like I've, volleyball players that have troubles in their shoulder, and we'll do regular assessment with physical therapy and we'll figure out where it is. But as far as dialing into the actual location, I'll use the ARP unit to be able to search on the surface of their body with the pads. So same thing, I'll use the wet pads to be able to search over front of shoulder, upper traps, back of shoulder, all the way into lat. So we can trigger and like we provide a current at an increasing intensity over time. And with that information, wherever they have the pain response that's the highest, I'm giving, they're telling me back and forth, hey, I'm an 8 out of 10 here. And then I move it a little bit. Oh, it's a 9 out of 10 here. And I find out exactly where that location is. And that's the area that we start training on first, with the motion that they need to do. So if it's a spike or if it's, whatever situation it is that they're going through, we can figure it out and we can dial into that response. We can even dial it into the point where we know what fiber direction we want for the muscle fibers. So nice. Either like a vertical or a horizontal setting.
Yeah. Now that you've been experimenting with it or using it for the last 5 years, are you shocked that the muscles that you're kind of finding are nowhere near the origin of the pain? Or tell us a little bit about your experience with that.
Yeah, it seems like the older the athlete, the more diverse locations are. So, and that it's the whole theory that, as some of our experiences continue within our lifetime, we have more chronic illnesses and chronic problems. And even with myself, I had a shoulder injury in the past that kind of what brought me into physical therapy in my car accident. And I thought it was unbelievable because I had a dormant issue that was 10, 12 years earlier. And I was running through just a regular straight arm lift with the ARP pads on the locations. And it felt like my old surgery had come back. It was like sharp pain in the joint. So that even when you think you're quote unquote healed, the ARPneuro Therapy can take you further. So I loved the fact that I could work on both acute injuries and chronic injuries and of a lifetime.
That's great. Before I start diving in and asking some of your, success or experience with particular patients, somebody's already excited about your rental program. You've got a fan out there that's asking how much do you charge typically a patient to rent the PRS?
That's awesome.
You could just give a ballpark. You don't necessarily have to say the exact price.
Well, typically it involves a eval first. So you come in for an eval, we see how you're doing, we make sure that you're all set up. I'd make sure that they understand the movement patterns prior to releasing them with it. $150 a week is typically what we charge for the rental units.
Okay.
Nice.
Well, that's a good price. I may have to come out to Colorado and since my wife keeps stealing my PRS, I might have to come out there and rent it from you. Now my whole family is using it. Thanks. Mm-hmm. So tell us give us a few success stories just off the top of your head. What particular person or athlete or something that you just comes to mind as a first experience or somebody that you can share a story with about the success of utilizing the RX with?
I've got so many. Well, one of the most fun one was somebody that came in that had neuropathy into the legs and had difficulty walking for quite a long time. We're talking like decades. And what we did is we searched abdominals, low back. We ended up on multifidi, which are the long muscles that run along laterally to the spine, and then transverse abdominals in the front. So abdominal muscles going up and down right next to the belly button. And we were able to correct her gait with walking. So I just hooked her up and had her walking on the treadmill. And then we followed that with the home program. So it was excellent because you have that carryover. And I think that's what PT misses most of the time is they go home, they do the exercises, but they're unable to really keep that program going. And when you're working with these stability muscles, it takes quite a bit more encouragement. Usually that's about a 6-week program in order to get the stability muscles working, and we can get them turned around a lot faster. I see, anywhere between 2-3 weeks, like half the time almost. So that's an exciting turnaround. We'll do other modalities in clinic as well, but the neurofeedback, the ARP therapy with the walking has been amazing to see. Let's see what other ones. I think as far as what we're discussing tonight, the peripheral neuropathy baths have also been really outstanding here in clinic because with peripheral neuropathy learning in med school, typically we had always learned that if you have a traumatic injury or accident, your recovery of getting that nerve innervation back into your extremities, like your hands or your feet, you can pretty much get about 80% of what you'll get back in your lifetime within that first year. So what does that mean when you have like a patient that comes in that has chronic neuropathy that's been longer than a year, right? It's like, I only have a 20% chance of getting any more, right? When I found the ARPneuro Therapy, I was able to get considerably more back. It's just changed the whole game. So the fact that when I had a stroke patient that came in. Now she came in 7 months after having a stroke, and it was a stroke where she couldn't speak, lost language centers. There was just a lot of functional deficits, unable to feed herself, extend her hand, that kind of thing. She had what we call a hemiplasia, which is one side neglect, one side decreased range of motion, decreased strength. And we put her hand in the bath, and we did about, I believe, six to 10 sessions. That's typically on average what we're doing with people to be able to get their feeling back and their strength back. And she was unable to extend her hands. She was stuck in a flexion pattern. And by the end of that 10th visit, we had full extension, which was great. And then by the end of her treatment, she was getting a motorized bike, and she was riding for an hour and a half at a time. So just really, really great gains. It keeps people encouraged. It keeps them active. It keeps them wanting to do their therapy. And not everybody wants to show up for physical therapy. And so it's nice to see the gains.
So Dr. Meghan, a quick question on, especially with this patient you just referred to, did you see that these results stayed, or did they come back for kind of a maintenance treatment? How did that sustainability, how did that last for them?
Typically with the neuropathy, you want to challenge it, right? You want to continue to drive it. So you don't want to do one treat here and there. You want to try to pack them in and do as many as you can back to back, because if you stop, there's a little bit of a rewind back. So I would always encourage people to keep up with it and keep challenging themselves. And she was an active person in Colorado. It's hard to find someone that's not these days. So she just, keeps at it. Nice. And by doing so, we haven't had any backpedaling at all.
Is this one of those cases where you have her just go home with one of your rental units, with one of the PRSs?
Yep.
Awesome.
Exactly.
That's great. And are you starting to become known, obviously, for this new, the ARP treatment? I mean, I've seen clinics now where you can't even find them on Google, and they're wall to wall packed with people coming in, trying to get treated because of the success and the outcomes that you've had with your patients. Do you see that?
Yeah, we do pretty good, but there's always room for more.
Yeah, exactly. Well, there we go. Well, it sounds like, let's see, Neil might be a candidate. I mean, he wanted to rent one. Maybe you need to get him in and get him treated if he's got some issues. But yeah, it is amazing. It is amazing for that. So, but do you see that success? Does that kind of, does success beget success with other patients? And
absolutely. I think the breakthrough treatments are my favorite. When somebody hasn't, like, for example, another one that comes to mind where it was a good friend of mine that was trying to ski with her daughter, and she had knee pain and she wasn't able to bend, so she couldn't go fast, she couldn't do bumps, that kind of thing. She was having trouble keeping up, and she came in and we hooked her up and we did some squats with the ARP, and by the end of one session she got below 90, which was huge for her because she hadn't seen that in a really long time. So just the amount of range of motion gains, even total knees, like people that are post-surgical and come in and they've done, insurance-based therapy for 3 months, and then they come in and they want to try something more, something accelerated, and I hook them up with the ARP, and we're doing, we're regaining 13 degrees of knee extension within one visit. It just, when you have that elicited response to the muscles and you can turn it up and dial it in, and you have the person breathing through it, and you have all of those resources for them, I mean, you have incredible results.
That's
Dr. Meghan, what's your favorite thing to treat? I mean, I know that's kind of a weird question, but when somebody walks in and you know if you treat them with the RX, you know they're going to get a lot of great results. What do you see the most of in that?
I would say the baths, to tell you the truth, because the peripheral neuropathy has been it's essentially been the forbidden treatment for a long time. I mean, people are on gabapentin. They're on like ridiculous anti-inflammatory medications that are synthetics for a long period of time. That messes with their balance. It messes with like their head. There's a lot of hardship that comes with being on medication for a long time. So being able to get them off that and being able to get their life back. Some of my older people that come in that have peripheral neuropathy issues with their feet and their balance, being able to turn that around for them, it's not being offered in a lot of other locations. So it's something that really needs to get out there, and people need to understand, like in stroke clinics and for CVAs, for people with rheumatoid, it's a really good resource that is really easy to use. And it's a gentle type of therapy. In the past, I was using, I still do dry needling, but I was doing dry needling around the nerve roots so that people could decrease the tension on their nerves. And that's a lot more painful than putting your feet in bath and just, having the toe curl kind of thing, or putting your hands in the bath and having that happen.
Sure.
So it's a lot more welcome than some of the more extreme modalities that do something similar to it.
Oh, that's great. It sounds like you treat a lot of athletes too. Do you do a lot of student athletes or collegiate athletes, professional athletes, or all of the above?
Yeah, I get a lot of kids that are pre-nationals, that are going out for scholarships, things like that. Archery, some basketball, some lacrosse players, like a lot of really, really interesting folks that are trying to really dial it in and get the competitive edge. So that's been a lot of fun too. So yeah.
And have you made believers out of some of the coaches and athletic directors? And I mean, because I've seen that, in my own son's high school. Like, man, once he got fixed, it's like the floodgates open with other football athletes and other high school athletes, because obviously it's such a short period, junior, senior year, and if you got any issues, probably not the best time if you're trying to be a collegiate athlete, for sure.
Absolutely. And the fact that they have such quick turnover in so many games in such a short period of time, they're really being challenged. So it's nice to keep them on that competitive edge. And then not only for the performance side, but the recovery side. The recovery side is huge. So being able to have back-to-backs and avoiding injury, I mean, that's a priceless thing. So
yeah, for sure. Looks like we got another question, Jake.
Yeah. So Kim was asking, is the foot bath the best way to help with neuropathy, burning pain on the top of the foot?
Do you want me to answer that one?
Yeah,
absolutely. Yeah. From your experience, have you seen that?
Yeah, absolutely. Neuropathies come in there's a bunch of different symptoms. So you can have burning pain, you can have numbness, tingling, shooting pain. But I mean, I've worked with all of them, and yes, bottom of the foot has the most receptors. Also, bottom of the hands, most receptors. We're talking 17,000 nerve endings on the palms of your hand, right? So that's eliciting a response. Then coupled with the bath, where you're getting all of the other surface area around the region, I think that was the secret. In the past, when I was working with neuropathy patients and being a spine PT for quite a while, I did dry neuro re-education, so the dry pad use, and I didn't have the same results at all. And not only that, is when you have somebody that has decreased sensation in an area and you're adding a dry pad to it, the possibility of an injury from that, because they can't say it's too much, it can be dangerous. So I like the fact that we have the water bath, because it allows the whole area to get the input of the signal without any kind of injury or any kind of problem that way.
Yeah, that's a great point.
I'd love to ask both of you this question, because I'm hearing a lot about neuropathy, and what are some of the causes, and how and why do people get neuropathy of their hands or feet? Is there a common occurrence for that? Or I'd love to hear your input, both Jake and Dr. Meghan.
Sure. I see a lot of neuropathies that come initially in my career. I was working with more of an obese population. I saw the diabetic neuropathy. So that's definitely one of the most common things that you'll see in more rural areas that are people have more chronic illness kind of issues. So yes, that's one. The other ones are that we see a lot is from car accidents. So traumatic injury neuropathies, where you have essentially a crushed nerve that's in the peripheral setting. So if you guys, the central nervous system is where your brain and your spinal cord is, and that's how the nerves are regulated through central nervous. And then once they pass out through the column into the periphery, that's your peripheral nervous system. So that's your sensation, your motor centers. And those are the areas where you have the compression from, say, a crush injury or something like that, a car accident, or even just somebody that has really bad posture. Over time can create the dampening of the nerve or the compression of the nerve root. And then you have the decreased sensation. So yeah, typically, I think the diabetic neuropathies, as well as the car accidents or traumatic injuries from sports, is where I see them mostly.
What's often the age group with that you see? Because I know you say a lot of times in time you'll see some of that the muscles become dormant, they start to develop that. But is there a specific age that's pretty common to be be aware of it?
For which part?
Just for probably mostly just neuropathy in general.
People a lot of the time don't realize they have it going on too. So that's an interesting thing. So as far as the age, the more I wouldn't say it was really an age, it's more of a body conscious thing. So the more aware you are of how your body feels, and you don't just kind of shrug it off and you want to treat the root cause, those are the people that typically will be the younger demographic. When it gets really obvious when you're older and you've got pathologies like browning of the skin, decreased hair growth, decreased circulation, tremors, things like that, then it's, pretty obvious. So yeah, it hits all ages. People like kids that are young that get concussions can have it, right up to older age, where you just have decreased myelination of, I guess I'm getting too technical, but sorry, when you over time, when you get older, you have the connection decreases with certain pathologies too.
Interesting.
Well, you weren't getting too technical for me, because
Dr. Dre over here.
After, but no, that's great. We do have a question that came in. I don't know if Jake, you want to read it?
Yep. So Bob kind of chimed in here and said, I had a friend that has pain in the ball of his foot. How to hook up, and how long should he treat the area, and for how often?
For that one, I would do the same as we talked about for the hands, but it's under the base of the feet. So you put the pads. I actually have a pad right here. Here's the pad, the sponge, the clamshell, and you put it under the base of the foot. And then I use a strap to hold it on inside the water bath. And I just use a regular foot water bath, and then I attach it. And I'm a little bit different. Instead of going onto the quads, some people I'll go onto the quads, but if the neuropathy goes all the way up, like I don't know if your friend ball of the foot, how long? Okay, I don't know how high it goes for him. If he feels the pain all the way into the sacrum or into the back of his hips, I would go all the way up to where that pain originates, with the pads. And also opposite foot, opposite side of your back. And then 20 minutes is what's suggested. They can go up to 30 minutes too and have good effects.
Nice. Yeah, great answer. You're squared away, Dr. Meghan. You have all the equipment around. You're going to take my job on the next one. If you want to work the next Q&A, you're already doing better.
Yeah, well, without question, we've never had these questions, because
we have another one popping up here.
Yeah.
So again, so Patricia's asking, can this therapy help a person with writer's cramp? And before you answer, have you faced this? Anybody coming in with writer's cramp?
Is writer's cramp just hand cramps and stuff?
I'm guessing that's what she means.
Okay. Cramping, when anybody has cramps, I also look at nutritional platform. So I'll look at and see what their zinc, their magnesium, potassium, calcium, all of those, make sure those are in good levels, because that's a big, big indicator. Make sure they're hydrated enough. But, once we have that conversation and we find out that the nutritional platform's stable, then yeah, absolutely, I would get after the ARP. It's definitely not going to hurt.
Not at all.
So you raised your hand. I got to ask, can I see that? Can you raise your arm, your right arm?
I saw that tattoo too. Oh, I thought that was a tattoo.
Okay. Okay. I thought it was a tat. So I was
So
going to be
did I.
really excited.
No, this is neurotech, actually. We use a bunch of different neuro stuff in our clinic.
Very
Nice.
cool.
So let me ask you, do you also have Voxx Socks?
Yes.
Oh, I love it. I'm wearing them right now.
Me too.
Okay, can you explain what is the Voxx Socks, please?
Oh, it's wonderful. It's neurotechnology. In fact, if you have a person that has peripheral neuropathy, I would put them in the socks too. So the socks, basically what it does, it creates an imprint on the bottom of the foot or on the arm. I'll show you the arm part. So here's.
Yeah.
Nice.
You can't really see.
I can see that. Yep.
Oh yeah.
Leaves like that mark of so that rubber there that you're seeing, that's essentially kind of that's the connection.
So that's essentially like a cord that plays into the brainstem to open up cognitive thought as well as decrease anxiety. So a lot of my patients that have anxiety or any kind of cognitive will put that on them, and that helps them focus.
Nice.
But for the socks, it's also technology that goes on the base of the foot across the metatarsal break, so right at underneath the knuckles of the feet, and it sends a signal up the train up to the brain to be able to improve performance, decrease inflammation, improve balance and stamina. Nice. So all of those things help. I mean, with the peripheral neuropathy into the feet, I worry about balance. So that's going to be one of the big things that I try to set people up with as well.
That's great.
And we had another question kind of pop up here. Kim came back again and asked, would you put the pad on the bottom of the foot for the burning on the top of the foot?
Yep.
Wonderful. And if this is only one foot, do you just put a pad on the other foot?
Both feet.
Both feet. Yeah.
Yep, both feet on the bottom, more receptors there, and your feet, the top of the foot is underneath the water bath, so that'll also get the treatment.
Mm-hmm. For sure. Excellent. Great question.
Yeah, great question.
Matt, what do you got, sir?
I'm blown away. I think what I get is I've got to figure out how I can get Dr. Meghan to host the Q&A's with me. She's absolutely amazing.
I'm fired.
I didn't want to do it live. I was going to do it after we get off, but no, Dr. Meghan, very, very impressive. Very excited to have you on. This is incredible.
I appreciate you guys.
So Kim is asking, where do you get the socks? Are they available? Do you sell them? Can they buy them on the internet?
Yeah. We can give us a call and we can set you up. I can also put a link in for you guys, so you can purchase through online. They're incredible. There's a great resource, or just come by the clinic and check them out. We've got a lot of different things here that we use.
So where exactly is your clinic? Because we've got people all over. How far are you from Denver? What area of Colorado are you?
So if you were to look at a map, we're halfway between Denver and Colorado Springs. So It's a pretty good location. We're 40 minutes south of Denver, 40 minutes north of Colorado Springs.
How far do patients travel for your services typically with the ARP?
We have a bunch of people from Colorado Springs. We have a bunch of people from Denver. I've got some from Boulder. I had someone come down from the mountains from Loveland. So it's been great for expanding our exposure. Yeah.
Yeah. And it's all word of mouth and outcomes, I got to believe, correct? Right.
Yeah.
Yeah, 100%.
And you guys are streaming through my social media page right now too, which is kind of awesome.
That's awesome.
The grassroots stuff is where it's at. I want to help the people that are local. I also want to help the people that are further away, but it's all about building that community right around us, and the best people to spread the word are the patients that come in and have the results. So
Dr. Meghan, how can people find you? What's your social media? What's your hanger on that?
I believe so the Instagram is the Good News Doctor _fit. FIT. And then My website is fixittherapiesllc.com.
Fixittherapiesllc.com. Got
Yep.
it.
And therapies is plural IES. So
This question is for everybody. What is your pick, Buffalo or New York? I guess Buffalo or the Jets.
Yeah, well, I will let Dr. Meghan go first.
Oh, you're afraid to answer?
No, I got my answer, but I don't want to influence Dr. Meghan because I feel like I'm due for a win tonight. So
I don't know. I
Right.
think I'll leave the fifth on that one.
yeah, I have a feeling, the hard knocks,
Mhm.
the distractions. I got to go with Buffalo tonight.
Yeah.
But
I think the game already started, but yeah, that's my pick too. It's
no, I think it starts in 3 minutes.
Does it?
I think it starts at 8. Otherwise, we would have lost all these great questions. People would be watching the game. No, I'm kidding.
Someone jumps in and says Jets.
Somebody says Jets. We got some JETS fans. So now all of a sudden, now I'm fired.
I've got a lot of Jets fans coming in.
Somebody needs to repeat the website. So
fixittherapiesllc.com. And pardon us because we're under construction, but so it looks a little bit under construction right now. But
and you're on findourclinic.com, right? I mean, you're on our
yes.
Yes. Okay. Perfect.
Yeah, I'm your clinic in Colorado. So when you want to buy a unit or rent a unit or try it out or do accelerated rehab, you come to us and we will set you up with all of it. We've been using it for 5 years now. We love the technology and it makes PT less boring for sure. It makes you want to move again and keep moving. I mean, even, people that are in a lot of pain and they call in and they say, hey, I can't come into PT today. I'm like, just come in and we'll get you a unit and you can go home with the unit at the very least. So, I mean, this can help make your day a lot easier, a lot better. Don't stay in bed if you're in pain. Come in and see us.
Yep.
And we'll get you moving. The moving is the best that you can possibly do for your body.
Maybe you'll get Aaron Rodgers to go to your office because I just got word from Colin that Aaron Rodgers was carted off with an ankle injury. Sounds like a foot bath.
Oh boy, are you kidding me? And I saw somebody just text Buffalo's up 3-0. So
all right.
Oh boy,
it's gonna be close. I think.
So, I'm looking at Find the Clinic just because I'm just curious. How many clinics do we have in Colorado? Do we have many? Do you know, Jake?
Dr. Meghan's our doctor.
Yeah.
I love it.
Yeah, she's the rock star. She's the rock star holding the fort.
So now anybody in the Colorado, the entire state of Colorado, has got to come.
You have to be there.
Therapies LLC. I love it. Okay. That's well, unfortunately, we're probably going to get calls from other clinics in Colorado, but we will try to keep them as far away from you as we can. So that's awesome.
You're a rock star, Dr. Meghan. You're a rock star.
Yeah, I cannot thank you enough. I think we're kind of coming down to our final minutes. If there's any other questions, Jake. Just regular water. I think there was another. There's a ton of questions coming in here. So let's see. Go ahead, Jake. I don't know.
All right, we'll put that in there. We'll have time to get some of these, and then can demyelinated nerves be regenerated?
Demyelinated.
Demyelinated?
Mm-hmm.
Don't even know what that means.
Yeah. So demyelination of the nerve, that comes with different pathologies like MS. And that's something chronic that happens over time. And I have yet to experience that so far with ARP, but I would, Virginia, come on in and we'll try you out and see what we can do. I've got some other tricks up my sleeve also for MS, and I would love to work with you on that.
Excellent. Yeah. Thank you for answering that. And we're getting a lot of things for the socks. I think that link, you said that link on the socks already, right? I think
it's on your website. Is that right, Dr. Meghan?
Yeah. If you go to the website, you can click right on the Voxx site, and then there's like a little icon. I think it will say like affiliates or something like that, or partners, and you can click on that and go right to it. And then the ARP is on that too.
Well, we know everybody's got to be on the ARPneuro. So here's a simple puzzle. Go to the ARPneuro Clinic or the ARPneuro website, find a clinic, go to Colorado, get to the website. It's an easy path. So,
there it is. It's all there. Yep.
That's great. Well, listen, it sounds like it's 3-3, so plenty of football left this evening.
That's right.
And Dr. Meghan, what a great Q&A. I mean, one of the best for sure.
You guys are
really appreciate your time.
absolutely. It's been great working with you guys.
Thank you very much, Dr. Meghan. I know we had a lot of questions coming in. We probably missed a few. We apologize for that, but thank you for all the questions. And I guess it's going to be tied so far. So if you're getting ready to tune into the game, you didn't miss any of that. But thank you for all the energy in here.
Yeah, I'm looking forward. We got to get Dr. Meghan rescheduled. This was too good, and there's too many other questions.
100%. Yep.
Thank you so much. Appreciate your time.
My pleasure. Thanks, boys.
Have a good evening. Thanks.
Thank you, everybody. Take care. See you next time.